I ended up in a hospital this summer with an emergency. I had a headache that was causing vomiting, and they couldn't stop the vomiting. And so when I was in the emergency room all day, they were giving me Dilaudid and Zofran and hanging a bag for hydration, and nothing was working. And so after a day of trying, the emergency room doctor said, you know, I'm going to do a CT scan. I'm not going to find anything, but I don't want to miss anything. And can I keep you overnight? Because you're not making any sense. And I said, sure. So rolled into the CT scan. 10 minutes later, that same doctor came running in with huge eyes and a pale face and said, oh my God, you have a massive tumor in the middle of your head. You're on your way to ICU, and we've ordered an MRI.
Acoustic neuroma is a benign tumor that starts on the auditory nerve, which is the hearing nerve. It actually starts on the balance portion of the hearing nerve. So the initial symptoms can sometimes be dizziness or imbalance, and frequently hearing loss. And as the tumor grows, it can eventually take the hearing. Once that happens, or just prior to that happening, is usually when it gets diagnosed. And unfortunately for Annie, her tumor got to be quite sizable before any of the symptoms were recognized.
It was an acoustic neuroma, and it was quite large. It was larger than a golf ball, and it was behind here, kind of right in the middle. It had already pushed the whole cerebellum sac, so you couldn't even see that on the MRI, and it had to come out, and it had to come out very rapidly.
By the time her tumor was diagnosed, the size of it was outside the range where we could use that radiation methodology. So she was relegated to attempting to have her tumor removed.
So the world changed in a breath, and the next morning I physically saw how big it was. And I had called a friend of mine who's a neurosurgeon down in Orange County, and he said, we need to get you to USC to the best there is. And I said, okay. And so then I needed to go, and the hospital that I was at wouldn't let me leave. They said I was too risky. And so the neurosurgeon from that hospital came in and he said, well, what's going on? And I said, I need a second opinion. And he said, you're too risky to move. And I said, well, no, I need a second opinion. He's like, well, who do you want to go see? And I said, Dr. Stephen Giannotta at USC. And he's like, oh my gosh, he's the best in the country. If he'll take you, I'll let you go. I said, he's waiting.
One of the most feared complications of the surgery for acoustic tumors is weakness of the facial nerve, which obviously is cosmetically disfiguring, and everybody wants to avoid that. Well, the bigger the tumor is, the more chance of having that condition in the post-operative period, virtually despite the, let's say, the skill of the surgeon. So she was in a somewhat precarious position when she came in for surgery.
I didn't want to know a lot. I'm not big on needing to know what's going to happen once you've decided to enter the head. Needless to say, next to my brain. I knew they were going to make a small incision, and I knew they were going to have to take out a portion of the skull, and it was going to be replaced with a tiny titanium plate, and they were going to try to do their best to remove the tumor. At the time, we weren't sure if it was cancerous or not, so we knew we were going in and it would be biopsied, and we'd find out yay or nay on treatment afterwards.
It's a long, tedious surgery. Usually takes, for a 4-centimeter tumor, usually takes at least 4 hours. They're going to be in the hospital and going to be in the intensive care unit. There are other nerves surrounding the tumor, nerve that gives you sensation to your face, the nerve that allows you to swallow. So those nerves are potentially in jeopardy, so that's one of the risks of the surgical procedure that people have to take into consideration before they give their permission to have the surgical procedure. So you go over all those risks and then compare that with the benefit. And the benefit is potentially it's a benign tumor, potentially they could get a surgical cure, and if they do, then they can virtually spend the rest of their life forgetting about the problem.
The 4-hour surgery was 9.5, and I'm here and we're 4 months out. He checks on me and tells it like it is. There's no beating around the bush. There's no sugarcoating anything. He's very candid. He lets you know exactly what you're going to go through. And Dr. Giannotta is one of those guys that you know you're in the right place. You know you're with the best.